One of the athletes caught doping is Marion Jones, which lost 5 of her medals on Sydney 2000 Olympics.
You have betrayed your trust. I want you to know that I have been dishonest. And you have the right to be angry with me.
The World Anti-Doping Agency banned all forms of diuretic used in sports. The table summarized that diuretics is the third most abused substance in all sports. Furosemide and hydrochlorothiazides are the top 2 diuretics used as masking agents. Usage of diuretics in sports includes rapid weight loss, which is beneficial in entering weight category sports, and masking the usage of steroids and other performance-enhancing drugs by dilution of urine. Diuretics mainly act on kidneys by increasing water and electrolyte excretion. This diagram of nephron and blood flow shows bodily fluids that pass through the afferent arteriole of glomerulus were filtered into Bowman capsule to pass through proximal tubule, loop of Henle, and distal tubule. Each of these has varying degree of water permeability and fluid reabsorption. Unabsorbed fluid would go through collecting ducts, which are then excreted from the bladder as urine. The site of action of loop diuretics like furosemide is on the ascending loop of Henle, producing around 4 liters of urine per day. This is due to excretion up to 15 to 25 filtered sodium ions by inhibiting sodium-potassium 2-chloride symport in basolateral membrane. All sodium, potassium, and 2-chloride ions enter by the cotransport system marked by X. Sodium is then pumped into the blood by sodium pump called P, which also pumps out potassium from the blood back to the membrane via potassium chloride cotransport system called C2. Chloride exits the cells in 2 ways, by chloride channels and by C2 system. Some potassium returns to lumen via potassium channel and some sodium absorbed through zona occludens. In thiazide diuretics such as hydrochlorothiazides, 1 until 2 liters per day is produced. The action takes place in the distal convoluted tubule as shown. Same process happens here, but mainly acts on the sodium chloride symport. In both systems, there is a total of 3 sodium and 2 potassium exchange. Dehydration can lead to blood thickening or hypercoagulation, fast heart rate or tachycardia, and kidney failure. Electrolyte imbalance in diuretics cause excessive uric acid accumulation in cells and called as GOT. Muscle spasm or muscle cramping is another common side effect. Excessive spasm results in inside bruises and skin rash. Postural hypotension include dizziness, lightheadedness, syncope, weakness, fatigue, and blurred vision. Athletes, particularly in bodybuilding, have lost their life at a very young age because of performance-enhancing drugs and diuretics. So, are diuretics worth the cheat?